Listen carefully, because what I'm about to share could protect your heart, your brain, and your life. If you're over 60, chances are you're already taking supplements to stay healthy, and one of the most popular is vitamin B12. It's praised for boosting energy, supporting memory, and protecting your nerves. But here's the shocking truth. Taking vitamin B12 at the wrong time or with the wrong medications can actually do more harm than good. And this is something most people have no idea about. Let me explain. As we age, our bodies naturally absorb less B12. That's why many seniors turn to supplements. But what they don't realize is that certain medications, very common ones, can interfere with how B12 works inside your body. As you move past the age of 60, something very important begins to change inside your body, something you cannot see, something you cannot feel right away, but something that can slowly impact your energy, your memory, your nerves, and even your independence. I'm talking about your body's ability to absorb vitamin B12. Now, most people believe that if they're eating well or taking a supplement, they're covered. They think, I'm doing the right thing, I'm taking my vitamins every day. But here's the truth that many people don't realize. It's not just about what you take, it's about what your body can actually absorb and use. And this is where the problem begins. Vitamin B12 is essential for your body. It plays a critical role in producing red blood cells, maintaining healthy nerve function, supporting brain health, and helping your body convert food into energy. Without enough B12, your body starts to slow down in ways that can be subtle at first, but very serious over time. Now, here's what happens as you age. Your stomach produces less acid. This is a natural part of aging. You may not notice it, but your digestive system is not as strong or efficient as it once was. And that stomach acid, often misunderstood, is absolutely essential for one key reason. It helps release vitamin B12 from the food you eat. You see, B12 in food is tightly bound to proteins. In order for your body to absorb it, your stomach acid must first break those bonds. Then a special protein called intrinsic factor binds to B12 and allows it to be absorbed in your intestines. But when stomach acid levels drop, this entire process becomes weaker, slower, and less effective. So even if you're eating foods rich in B12, like meat, eggs, or dairy, your body may not be extracting what it needs. And here's the part that's even more concerning. This decline doesn't happen overnight. It's gradual, silent, and often unnoticed until symptoms begin to appear. You may start feeling more tired than usual, not just I need a nap tired, but deep, persistent fatigue that doesn't go away with rest. You may notice your memory isn't as sharp. You walk into a room and forget why you're there. You struggle to find the right words. You feel mentally slower. Some people experience tingling or numbness in their hands and feet. Others feel unsteady when they walk, like their balance isn't what it used to be. These are not just normal signs of aging. These can be warning signs of a B12 deficiency. And if left unaddressed, this deficiency can progress to more serious nerve damage, cognitive decline, and even mood changes like depression or irritability. Now, here's something that might surprise you. Even if you're taking a B12 supplement, you might still not be getting enough. Why? Because many traditional B12 supplements still rely on the digestive system to be properly absorbed. And if your stomach acid is low, that absorption may be limited. So you could be taking your supplement every single day, believing you're protecting your health, while your body is still running low on this essential nutrient. This is why so many adults over 60 are unknowingly deficient in B12. It's not because they don't care about their health. It's because their body has changed and they haven't adjusted their strategy. And I want you to think about this for a moment. How many people are walking around feeling tired, forgetful, or weak, assuming it's just part of getting older? How many are being told that's normal at your age, when in reality, their body is simply lacking a key nutrient? This is where awareness becomes power. Because once you understand what's happening inside your body, you can begin to take the right steps to support it. You can start asking the right questions. You can begin to look at your health differently, not as something that declines with age, but as something that can be supported, strengthened, and improved with the right knowledge. And it all starts with recognizing that your body is not the same as it was 20 or 30 years ago. It has different needs. It requires a different approach. And when it comes to vitamin B12, absorption is everything. You don't just want to take it, you want to make sure your body can actually use it, because your energy depends on it. Your brain depends on it. Your nerves depend on it. and ultimately your quality of life depends on it. So don't ignore the signs. Don't assume it's just aging. Start paying attention to what your body is telling you, because sometimes the smallest deficiency can lead to the biggest changes, and the sooner you recognize it, the sooner you can take control and protect your health for the years ahead. Now let's talk about something that millions of people rely on every single day. Medications for acid reflux, heartburn, and digestive discomfort. On the surface, these medications seem like a lifesaver. You take a pill and within a short time, that burning sensation in your chest is gone. You feel relief, you feel comfortable again. But here's what most people are never told. That same medication giving you relief could be quietly interfering with one of the most important nutrients your body needs, vitamin B12. And if you're over 60, this becomes even more critical. You see, medications like proton pump inhibitors, PPIs, and antacids are designed to reduce or neutralize stomach acid. That's their job. They calm the symptoms by lowering acidity in the stomach. But what many people don't realize is this: stomach acid is not your enemy. In fact, it's absolutely essential for proper digestion and nutrient absorption. And when it comes to vitamin B12, stomach acid plays a crucial role that cannot be replaced. Here's how it works. When you eat foods that contain B12, like meat, eggs, or dairy, that vitamin is tightly bound to proteins. Your stomach acid is responsible for breaking those bonds, releasing the B12 so it can be absorbed later in your digestive tract. Without enough acid, that B12 stays locked up, unavailable, unusable. So even if you're eating a healthy diet rich in B12, your body may not be getting the benefit. Now think about this for a moment. If you're taking acid-reducing medications daily, and many people do for years, you are consistently lowering your stomach's ability to do this important job. Day after day, week after week, year after year. And the effect builds slowly, silently. You don't feel it happening. There's no alarm going off. But over time, your B12 levels can begin to drop. And here's where it gets concerning, because the symptoms of B12 deficiency don't always show up right away. And when they do, they're often mistaken for something else. You may feel more tired than usual. You may notice weakness in your muscles. You may have trouble concentrating or feel mentally foggy. Some people begin to experience tingling or numbness in their hands and feet. Others feel dizzy or off balance. And many are told that's just part of getting older, but it's not always aging. Sometimes it's a deficiency that's been developing for years right under the surface. Now let's go even deeper. There's another layer to this problem that most people never consider. When stomach acid is reduced, it doesn't just affect B12, it can also impact the absorption of other important nutrients like calcium, magnesium, and iron. So what starts as a simple solution for heartburn can turn into a chain reaction affecting multiple systems in your body. Your bones, your muscles, your nerves, your energy levels, all connected, all influenced by what's happening in your digestive system. And here's something very important to understand. Many people begin taking these medications without realizing they were never meant for long-term use. They were designed for short-term relief. But instead, they become part of a daily routine, a habit, something you take without thinking twice, and over time your body adapts to that lower acid environment. It becomes the new normal. But that normal may not be supporting your long-term health. Now, this doesn't mean you should suddenly stop taking your medication. That's not the message here. These medications have their place. They can be very helpful when used appropriately. But what it does mean is that you need to be aware. You need to understand what's happening inside your body so you can make informed decisions. Because once you know that acid plays a vital role in B12 absorption, you begin to see things differently. You begin to ask better questions. You begin to think, if I'm reducing my stomach acid, how is that affecting my nutrition? And that awareness is powerful because it gives you the opportunity to take action. Maybe it means discussing your medication use with your healthcare provider. Maybe it means evaluating whether long-term use is necessary. Maybe it means checking your B12 levels regularly to make sure you're not becoming deficient. Or perhaps it means adjusting how and when you take your supplements so your body can absorb them more effectively. These are simple steps, but they can make a significant difference. Because at the end of the day, your body is a system. Everything is connected. And when one part of that system is altered, like reducing stomach acid, it can have ripple effects throughout your entire body. So don't overlook this. Don't assume that because something is common, it's without consequence. Pay attention. Stay informed. And most importantly, listen to your body. Because sometimes what feels like relief in the short term can lead to problems in the long term if you're not careful. And when it comes to your health, awareness is always the first step toward protection. Now let's talk about something that affects millions of people around the world, something that is often prescribed, trusted, and taken every single day without a second thought. I'm talking about the medication known as Metformin. If you're over 60, there's a very high chance you either take this medication or you know someone who does. It's one of the most commonly used drugs for managing type 2 diabetes. Doctors prescribe it because it helps lower blood sugar levels, improves insulin sensitivity, and reduces the risk of complications associated with diabetes. And let me be clear, this medication can be very effective. For many people, it plays an important role in controlling blood sugar and protecting long-term health. But here's what many people are never told. While metformin is helping one part of your body, it may be quietly depleting something essential in another. And that something is vitamin B12. Now, this isn't a rare side effect. This is something that has been observed in study after study, year after year. Long-term use of metformin has been strongly associated with reduced levels of vitamin B12 in the body. And the longer you take it, the greater the risk becomes. Let that sink in for a moment. You could be taking a medication every day to protect your health, but at the same time, you could be slowly becoming deficient in a vitamin that your body absolutely depends on. And here's where it becomes even more concerning, because the symptoms of B12 deficiency can look very similar to complications of diabetes itself. You may begin to feel tingling or numbness in your hands and feet. You may notice a burning sensation or a loss of sensitivity. You may feel weakness in your muscles or have trouble with coordination and balance. Now, what do most people think when they experience these symptoms? They assume it's diabetic neuropathy, and in many cases it is, but what if part of the problem is not just the diabetes, but a hidden B12 deficiency caused or worsened by the very medication being used to treat it? This is where things can become confusing and even dangerous if not recognized. Because if the root cause is not identified, the deficiency continues to worsen, and over time that deficiency can lead to permanent nerve damage. Yes, permanent. Vitamin B12 is essential for maintaining the protective coating around your nerves, known as the myelin sheath. Without it, your nerves become vulnerable, signals don't travel properly, sensation becomes distorted. And the longer this goes on, the harder it becomes to reverse. Now let's go deeper into how this happens. Metformin interferes with the absorption of vitamin B12 in the intestines. It affects the way calcium-dependent processes work in the gut, processes that are necessary for B12 to be properly absorbed into the bloodstream. So even if you're eating foods rich in B12, even if you're taking a supplement, your body may not be absorbing enough of it. And once again, this doesn't happen overnight. It's slow, it's silent, and it often goes unnoticed until symptoms begin to interfere with your daily life. Fatigue becomes more persistent, memory becomes less reliable. You may feel mentally foggy, less focused, less sharp. Mood changes can occur, irritability, low motivation, even feelings of depression. And many people never connect these symptoms to a vitamin deficiency. They attribute it to aging, to stress, to their existing health conditions. But beneath the surface, something deeper may be happening. Now I want you to think about this. How many people are taking metformin for years, 5 years, 10 years, even longer, without ever having their B12 levels checked? How many are experiencing symptoms that are being treated individually without addressing the underlying cause? This is why awareness is so important. Because once you understand that this connection exists, you can begin to take steps to protect yourself. You can have your B12 levels tested regularly. You can talk to your healthcare provider about monitoring this over time. You can explore different forms of B12 supplementation that may be better absorbed, especially forms that don't rely entirely on the digestive system. These are not complicated changes, but they are powerful because they address the root of the problem, not just the symptoms. And here's something else you need to understand. Your body does not store large amounts of usable B12 for long periods when absorption is impaired. So if the problem continues, the deficiency can deepen, and the deeper it goes, the more it begins to affect critical systems in your body. Your nervous system, your brain, your cardiovascular health, everything is connected. So while you continue managing your blood sugar, and that's important, you must also protect your nutrient levels, because true health is not just about controlling one condition, it's about supporting the entire system. And that means looking beyond the surface, asking questions, staying informed, taking an active role in your health, because no one knows your body better than you. And the more you understand what's happening inside it, the better decisions you can make for your future. So don't ignore this. Don't assume everything is fine just because you're following your prescription. Be proactive, be aware, because sometimes the smallest imbalance left unchecked can lead to the biggest consequences. And when it comes to your nerves, your mind, and your long-term quality of life, that's something you simply cannot afford to overlook. Now let's bring everything together, because this is where the real power lies. You've learned that vitamin B12 is essential for your energy, your brain, and your nerves. You've seen how age, reduced stomach acid, and certain medications can interfere with its absorption. But here's the most important part. It's not just about taking B12, it's about taking it the right way. Because the truth is, timing matters, form matters, and how your body receives that nutrient makes all the difference between benefit and deficiency. Most people believe that if they take a supplement once a day, they're covered. It becomes part of their routine, just another pill in the morning or at night. But your body doesn't work on assumptions. Your body works on absorption. And if that absorption is compromised, then what you're taking may not be doing what you think it is. Let's start with timing. If you're taking vitamin B12 at the same time as medications that interfere with its absorption, like acid-reducing drugs or certain diabetes medications, you may be limiting how much actually gets into your system. Think about it like this. If two substances are competing or interfering with each other inside your digestive system, one of them is not going to perform at its best. And in many cases, that's your vitamin. So spacing out your supplements and medications can be a simple but powerful strategy. Even a small adjustment, taking B12 at a different time of day, can improve how your body processes it. Now let's talk about form. This is where many people overlook a critical detail. Not all vitamin B12 supplements are the same. The most common form is a standard oral tablet that you swallow, but as we've discussed, this form relies heavily on your digestive system, your stomach acid, your intrinsic factor, your intestinal absorption, and if any part of that system is weakened, which is very common after 60, then that tablet may not be fully effective. So what are the alternatives? One option is sublingual B12. This is a form that dissolves under your tongue. Instead of going through your digestive system, it is absorbed directly into your bloodstream through the tissues in your mouth. This bypasses many of the barriers that can interfere with absorption. Another option is B12 injections. These are typically administered under medical supervision and deliver the vitamin directly into your bloodstream. For individuals with significant absorption issues or long-term deficiencies, this can be a very effective way to restore levels. Now, this doesn't mean everyone needs injections, but it does mean that you have options, and choosing the right one depends on your body, your health status, and your specific needs. This is why personalization is so important, because what works for one person may not work for another. And when it comes to your health, a one-size-fits-all approach is rarely the best approach. Now let's talk about monitoring. This is one of the most overlooked steps and one of the most important. You cannot rely on how you feel alone to determine your B12 status. Why? Because symptoms can be subtle, delayed, or mistaken for something else. You might feel tired and think it's just a busy day. You might notice some forgetfulness and assume it's normal aging. You might experience tingling in your feet and attribute it to circulation issues. But without testing, you're guessing. And guessing is not a strategy. A simple blood test can give you valuable insight into your B12 levels. It can show you where you stand. It can help you track changes over time. And most importantly, it can guide your decisions moving forward. Because once you have that information, you can adjust your approach. You can change the form of your supplement. You can modify the timing. You can work with your healthcare provider to create a plan that supports your body in the best possible way. And that's what this is really about. Taking control, being proactive, understanding that your health is not static, it changes, it evolves, and it requires attention. Now here's something I want you to remember. Your body is incredibly intelligent. It's always communicating with you, but it doesn't speak in words, it speaks in signals. Fatigue, brain fog, weakness, numbness. These are not random. They are messages. And when you learn to listen to those messages, you begin to understand what your body needs. So instead of just taking supplements out of habit, start taking them with purpose, with awareness, with intention. Ask yourself, is my body actually absorbing this? Am I taking it at the right time? Is this the right form for me? These questions may seem simple, but they can lead to powerful changes. Because when you shift from routine to strategy, everything improves. Your energy becomes more stable, your mind becomes clearer, your body becomes stronger, and you begin to feel more in control of your health. Not because you're doing more, but because you're doing it smarter. So don't settle for just taking it. Make sure your body is truly receiving it. Because at the end of the day, it's not about how much you take, it's about how much your body can actually use. And when you get that right, you give your body the support it needs to function at its best, today, tomorrow, and for years to come.